Welcome back to Wake Up with Cheddar. As governors on both coasts get down to the brass tacks of getting the businesses back up and running and trying to figure out when and how to quote unquote reopen the economy, business owners themselves are soon going to be forced to grapple with a delicate question. How do you keep your people safe and get back to some version of normal or semi normal business? To help us answer that question, we have Seth Harris, the former acting labor secretary under President Obama, joining us from DC. Seth, good morning, and thank you so much for coming on today. You laid out some steps that you think that business owners need to take. Can you walk us through them?
Sure. Good morning, Jill. The first step actually is not going to be up to business owners. It's going to be up to our governments. And that is we really need a comprehensive testing and contact tracing program so that we can know who's either sick or infected, because the first part of any employer's plan, and every employer needs a specific written plan about how they're going to keep their workers safe. The first part of that plan is to keep people who are sick or infected out of the workplace. Give them paid sick leave, give them paid family leave, limit deliveries, limit the number of people who are not employees from coming into the workplace. That's the starting place. The second step is to organize your workplace so that we can sustain the physical distancing we're doing in our lives right now, that you and I are doing right now, in the workplace. 6 feet at least of distance between workers, making sure that people aren't facing one another, plenty of hand washing stations and breaks in order to wash your hands. In some cases, physical barriers are going to be needed to keep people from breathing or coughing on one another. And that's the next step. And Governor Gavin Newsom in California has talked about this. We may need to reorganize our workplaces physically so that we can get that physical distance. So spacing out workstations, building barriers, making sure that there are doors in offices that maybe didn't have doors before, and other changes. And this is extremely important, particularly for the workplaces that are open right now. Workers are going to need personal protective equipment. One of the reasons why so many grocery store workers and people working in healthcare establishments and transit workers even are getting sick is because they do not have the proper masks, respirators, gloves, face shields, gowns, other things to keep them from getting sick when they come into contact with other employees and customers or other members of the public.
Seth, back to that issue of testing that you mentioned. This isn't the first time we've heard that across the board. Medical experts, business leaders say we need wide scale testing. Why is that not happening yet? Just from your perspective, as somebody who worked in the government, in the cabinet, why is the president not really getting the memo on that?
Well, I think he's trying to shift blame to the governors, but the President of the United States has a unique authority under a law called the Defense Production Act, where he can essentially command private businesses to produce the things that we need to produce in order to win a war. And he's described himself as a wartime president and the coronavirus as a silent enemy, but he's absolutely refused to invoke this Defense Production Act to get the ventilators that hospitals need, the masks and respirators that workers need, gloves, gowns, other things, face shields, the kinds of things that protect people from getting sick. And I must say, it seems to me to be ideology trumping common sense. And as a consequence of that, governors are competing against each other, and hospitals and cities are competing against one another to get these goods. It's bidding up the price. We're finding shortages all over the world, and result is a lot of workers, particularly healthcare workers, are getting sick and dying. It's just unconscionable in my view, and the president should be doing better.
If you were labor secretary today, what would you be advising the president?
Well, I tried to stay in my lane when I was labor secretary, and I'd be talking with him about the workplace and talking about whether we're ready to reopen. The first thing I'd say to him is, Mr. President, I've got my Occupational Safety and Health Administration, the people who are the cops on the beat of making sure that workers are being kept safe and healthy, that my OSHA is out there making sure that employers know what they need to do and that we're enforcing the law to guarantee that workers are being kept safe and healthy. Should give him some confidence that we are able to reopen the economy. Reopening the economy means sending people back to work. It doesn't just mean people getting back into the malls. It means that there are people in the stores, in the malls, in order to be able to serve them. That's 150, 160 million people. We need to know they're safe. Right now, the Labor Department is utterly failing to protect workers in their workplaces. And that's why we're seeing these really frightening stories, like the story about Smithfield Foods in South Dakota, where more than 500 workers in a pork processing plant got sick. That's not just a failure by the employer, that's a failure by the federal government to enforce the law. So if I were the Secretary of Labor, I would want to be able to go to the president and say, Mr. President, I've got this under control. Our federal Occupational Safety and Health Administration is working with the states to make sure that workers are being kept safe.
What do you think that restaurants, bars, cafes, theaters, what do you think they could learn from essential businesses that have been open for weeks now, places like grocery stores or pharmacies, for example?
Right. Well, that's the group of employers who I think are going to have to wait a little while before they can open up, because those are all places where we, belly up to the bar and we sit shoulder to shoulder and we're interacting with people, not just the workers, but with one another. Those are the places where it's going to be a while before we can get back and get into that kind of social interchange. But the lesson of grocery stores, for example, is that if you're going to have people in fairly close contact with one another, you have to have one of two things: either a barrier, and that's something we could do for grocery store cashiers right now, is put sort of a sneeze guard between them and the customers. I don't think you can really do that in a bar, but what you can do is ensure that the bartender and the waiters and waitresses and the busboys who are touching plates and coming into contact with customers have the necessary protective gear. So in some cases, they're going to need those really tight N95 respirators, sort of high-level respirators. Sometimes they're just going to need surgical masks. They're going to need gloves. You're going to have to clean very, very thoroughly. There's special guidance for how you make sure that a place that's been touched by a human hand that might have been infected, well, you got to clean that off in a very careful way. People are going to have to take breaks. They're going to have to be able to separate. I think a lot of bars and restaurants, and Governor Newsom, I thought, did a great job talking about this. They may have to reduce the number of tables that they have, the number of people they allow to sit at the bar, so that people can spread out and we can have plenty of distance between them. The new normal is going to be quite different from what we experienced before this pandemic hit. We're going to have to live with this for a while and protect ourselves and continue the social distancing that we're engaged in right now, or there's a real risk that we'll have a second big peak and we'll have another big hit to the economy, and a lot of people will end up losing jobs.
On that note, I do want to ask you about the jobless claims we're going to get in a couple of minutes from now. What are you expecting to see?
I think it's going to be more than we can bear. Again, we've had 17 million people who have lost their jobs over the course of the last month. We'll get the report in a few minutes. For last week, I expect it to be somewhere between 5 and 6 million people having filed for unemployment claims. That will take us to a total of around 30 million people in the United States unemployed that we can count. There are a lot more people out there who've just given up on filing for unemployment insurance or who've given up on looking for jobs at all. So the number is almost certainly higher than that. That puts our unemployment rate right now at 20% or higher. My guess is that we're now approaching the level that we hit in the Great Depression in the 1930s. The peak there was about 25%. I don't think we're quite there yet, but we are quite close. And the pain that's spreading across the United States, people who are worried about how they're going to feed their kids, keep their houses or apartments, how they're going to pay for their student loans. I think there's real panic across the United States. We're seeing it at food banks. We're seeing it at students who've lost their opportunity to go to college. I think this really is a tragic moment. And what has to happen is Congress needs to step up. They have not. I know it's strange to say this because Congress just spent $2.2 trillion, but that's nowhere near enough. That's maybe a third of what we need in order to be able to keep people going, hold them harmless for as long as we possibly can, so that we don't have a deep economic depression that we can't get out of for years.
All right, Seth Harris, former acting labor secretary under President Obama. Thank you so much for your time this morning. Great insight on all of this. Thank you.
Thanks, Jill.